Our mission at Housecall Providers is improving lives by bringing health care home. For over 20 years, we've been helping the frail elderly population in Portland because they could no longer physically get to a primary care clinic. But we've also been caring for members who are dually eligible or Medicaid eligible, and we're excited to be expanding that population for our Care Oregon members. We think it's a perfect fit.
My physical condition has gotten to the point where it's hard for me to do practically everything. And now I have Housecall Providers. The doctor can come to me. I don't have to get ready to go, and I don't have to rely on transportation because medical transportation sometimes never would show up, so I was all dressed up with no place to go.
I am not the average Housecall Provider patient. I am 27 years old, and I have end-stage renal failure, diabetes, and gastroparesis. I couldn't leave my house. I was in horrendous pain, throwing up. I couldn't keep food down, water down, nothing. Having a primary team come to my house and help me has opened up doors for me and given me a different life rather than being sick all the time.
It was so overwhelming, and so many new meds and a new diet and dialysis. It was just overwhelming. There's no other word for it. Anyone that needs care in their home, I would recommend Housecall Providers to them. The doctors have been great, the nurses have been awesome. I have nothing but good things to say about them, and they have been my savior.
I can only say my life's been a whirlwind. It's been ups and downs, more downs than ups. I was homeless. I'm sleeping in doorways, and it's cold outside, and I gotta find somewhere to eat. I go to the hospital. They said the next time I have any drug reactions, I might lose my kidneys. I might have to have dialysis, and that's what happened. When I go take the treatment, and they sucking my blood, I'm pushing it back in and everything. I don't know if anything may happen while I'm on this machine. And I'm very scared of that. Monica, she took a little bit of the sting away. She got this big old smile on her face, and it disarmed me. She talked to the doctors to make sure that the type of treatment that I'm getting is the treatment that I should be getting.
A few years ago, we got introduced to Housecall Providers, and we love it. We love it because we don't have to take my sister in. You know, if she needs an ultrasound, they call and bring ultrasounds out to the house. We got all that. I can call Ivan, the PA from Housecall Providers, and I'll say, hey, listen, you know, this is going on. And he'll say, hey, well, I'm in the neighborhood, let me just come by.
I was born with a morphine. I'm more susceptible in getting aneurysms. The last one was 3 years ago. The doctor, he fixed it, but then on the way out, he bruised the lower spine. I can't walk. I can feel it, but I can't move it. I'm just afraid that if I have another big operation, I may maybe quad or even worse is a coma. I'd rather just live the life I have, and who knows. My team is Monica and AC, and I told the family what I want to do, and some of the family just apparently didn't want to hear that, so they called Monica, and she calmed them down. It's nice to have one of those voices. I don't know where I would be if it wasn't for them.
A couple of years ago, I was really sick. Endocarditis, HIV. Actually, I was dying of AIDS, and I didn't know where to go. I didn't know the questions to ask, who to talk to. I was homeless. I was on the streets. I didn't really do anything to help myself. Being sick just kind of came with the territory until something really bad happened. And you were so sick like that you couldn't walk, and that's where I was. And since the team came into my life, I have been able to have my heart surgery. I've been able to get clean. I've been able to continue taking my meds. My HIV levels are non-detectable. They've truly helped me just work through this whole process. I don't know where I would be without them.
I see lives change, and I see outcomes change, and it's a miracle.
My son asked me to please get better because he didn't want me to die, that he wanted me to be around, he wanted to get to know me. Even though I'd let him down his whole life, I didn't want to let him down anymore. I didn't want to die a drug addict. It wasn't just me now, it was them. And so I kind of had my family and my team really to help me wrap their arms around me, I guess, until I could wrap my own arms around myself, till I could love myself.
What I enjoy most about this work is the fact that I get to work one-on-one with these patients. I get to spend the time I need, that they need, to develop that relationship. We basically become family. Sandy was one of our first patients on the Advanced Illness Care Program. We built a relationship quickly with her after multiple hospitalizations that she had.
My heart, it doesn't pump out. My heart doesn't, and it's getting worse. And there's nothing that can be done. It just has to be taking care of myself with my medications and not holding on to any of the luggage that makes me sicker. The more I told them about myself and the more we shared about each other's things, that they became closer and closer to me. I realized that, dying wasn't an option for me yet. My youngest daughter passed, and I was able to cope better with her loss because of them. When you have all these things, not just your health, but everything else coming down around you, plus the death of a child, you can't take that stuff away, but you can put it where it belongs. And you don't have to have it all on one plate. And that's what they helped me do.
When you have multiple chronic conditions, you don't have the energy it takes to get to the clinic every time you need a new thing addressed, whether it's pain, shortness of breath, a change in your health status, or a behavioral health issue. All of these things can get in the way and limit the energy you have for regular health care.
I was released from Coffee Creek. I did about 2.5 years, and I was released with stage 4 cancer. So the morning I woke up, I found out that I had no housing. It fell through. I'm walking through the gates, just thinking, what am I going to do? Where am I going to go? And I'm just thinking, I'm gonna die on the streets. I'm looking at my spiritual mom, and I had to tell her that my housing fell through and that I need help. Since moving to Rose Quarter Compass Oncology and meeting the advanced care team, I got a scooter, I got a wheelchair. They've fast-tracked, it seemed like, everything since I've had them. I felt like alone when I was in prison. I didn't have adequate health care. Now, if I need something, I can call one of the Housecall Providers. I finally got my own apartment. I get my keys on Monday at 2. I'm just really excited that I'll have more independence. I'm still fighting cancer. They gave me a time frame. My goal is to live as much as I can, but beat that.
Without Housecall Providers in my life, I don't feel like I would have a life.